Today, in a hospital room or a research lab, around a dining room table, or on a family couch, some of us will be forced to make an impossible choice.
Do we treat or not treat?
If you had cancer that ran in the family, would you have a child?
A life or death decision.
Maybe.
Maybe I shouldn't.
Yes, it's morally complicated.
That will impact them.
Sorry.
Their families.
We didn't know anybody who had done this.
It's sort of like a mass social experiment.
Even society.
So the question is, put yourself in a position like that. What would you do?
From the Ideas Lab at the Johns Hopkins Berman Institute of Bioethics. Listen to Playing God now, wherever you get your podcasts.
Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers. Today on the show, we are discussing sloths, screwworms, and what some of these headlines are saying about the larger story of animal health. Veterinarian and public health researcher Dr. Meghan Davis returns to the show to talk about a slew of sloth deaths in Florida, an outbreak of a previously eliminated flesh-eating parasite in cattle in the southeastern U.S., and why animal health is so important to human health. Just a note that we do discuss animal welfare and screwworm infestation in this episode. Let's listen. Dr. Meghan Davis, one of our regulars, welcome back to Public Health on Call. How are you?
Great to be here. Thank you so much.
And today, the overarching topic is why animal diseases matter for human health. This is something that you have come and talked to us about quite a bit through a range of different animals and pathogens. But we're going to cover this story from two current event situations. One is about sloths, and the other is we're going to cover New World screwworm. There's a lot to get to, so let's start off with the sloth situation. What's going on there?
Yeah, absolutely. So sloths are very charismatic. People enjoy spending time with them. And that has led to the establishment of places like Sloth World, where you can go hang out with the sloths. The issue and kind of why this has become in the news is that there were sloths at Sloth World who were recently imported through various channels, international movement of wild-caught animals into the United States. And they were very sick, and quite a few of them died. And there were necropsies, that's basically an autopsy, but for animals, that were performed and testing done that identified that they were carrying sloth gammaherpesviruses and a number of other pathogens. And that kind of raised the question of what does it mean when we have wildlife trade and movement of animals from places where, we may not fully understand or recognize all the diseases that might be circulating in those populations, and what might it mean for human health? Now, in this particular case, these were primarily problems that sloths have. So these were diseases of sloths and not something that humans can get. But that interface, humans go to places like Sloth World and interact with animals that might be carrying diseases. These are considered areas of higher risk when we think about the potential for something like a spillover event. And so just to catch everybody up, remember spillover is when you have a disease in usually a wild animal or other animal population that gets into the human population, often through direct contact. So that's why this has become a bit of a concern for people, given that, we're coming out of the COVID-19 pandemic and people understand a little bit better about the risks associated with spillover. There are many different ways that animals can get into the country. Some of them are illegal, but in this particular case, they went through normal customs clearance. Sloth World is in Florida, and so they, would come through the official channels for the USDA. in terms of their entry into the country. In this particular case, the sloths came from Peru and Guyana, but globally, the origins can be varied. It depends on the species and where that species has habitat and where there may be already established activities in terms of the import or export of animals.
And so the headlines were a little scary to people. They see that, this place where people can go and interact very closely with these animals were maybe a little bit more primed to think about spillover events. And then at the same time they're seeing those headlines, we are also seeing headlines about the New World screwworm. So I think both of these stories together are kind of lending themselves to this greater narrative. So what can you tell us about the New World screwworm?
Yes, a New World screwworm is considered an exotic animal disease. And exotic is, in this case, just outside of the United States. So it's one that has been in many other countries. We've had a lot of efforts to prevent the entry into the United States, but it's come up basically from the south. So we've been watching it move through Mexico. A screwworm is a larva. So it is the baby of a fly. And flies lay their eggs usually in very diseased tissue when it's a normal fly, right? So they'll not necessarily just affect anybody. It'll be some animal that already has some compromise points, so like a wound, and they'll lay it in the wound, and that's when you see the fly strike. But for New World screwworm, the fly will lay the eggs in perfectly normal tissue. And sometimes these can be in places that, and I kind of want to give a little content disclosure before I say, so if you're a little squeamish, just step away for one moment. So like even in like the eyes and on the face and head, it can be really, really impactful, right? And you can get mortality sometimes depending on secondary infections, the location of the infestation. And this can affect people. And so a little bit different than what we were just talking about with the gammaherpesviruses, which are really more sloth-based. This is a generalist, right? So these little larvae, can affect your livestock, obviously, and that's where we've seen it the most, but also pets like dogs or cats and people in some cases.
Where do we usually see screwworm in the world?
So it's been coming from the south through Mexico into the United States, and that's kind of our point of entry. So where we're seeing it in the U.S. is in Texas and New Mexico. We've got upwards of 15 cases at this point, and affecting not just our livestock, where we first detected it was in calves, where after they're born, they, have a little sort of entry point right at the umbilicus. Everybody knows, right? You got your belly button. And so that's a place where you can sometimes see this. But it's also been affecting small ruminants like sheep and goats, as well as pet animals. And so that's a big deal because, where you see it in pets, you might also have the same kind of exposure for people, as well as I think that other piece that you alluded to with the sloths is that when we interact with animals directly, like with pets or with named sloths at Sloth World, there's an additional component to the impacts on us, right? That we feel that, it's affecting our family or it's affecting those closest to us in ways that we may not think the same way about livestock. Although some people do, I will say. Some people absolutely feel that way about their cows and sheep and their goats.
And so screwworm, my understanding is that it was largely eliminated in the U.S. And so is this something that is coming into the country, or is it a reemergence, or is there a difference?
Yeah, that's a great question. So when we have eradicated a disease in an area, right, when we are free of it, then usually the entry points are going to be borders, which is what we have in this case. It's coming, the flies themselves, those populations have been moving north, and we've been trying to stop them using often like sterile males to try to diminish the population. So, if you've got sterile males, you're not going to have larvae, and those are the issue. And so that's been probably the main intervention. And so that's required, obviously, partnerships across the U.S.-Mexico border in order to deploy those in areas in Mexico where they're coming up. But now we're seeing it in a pretty widespread area across both Texas and New Mexico. And that suggests that, the fly populations are probably a little bit bigger than just like one or two coming across, right? This is probably a more established population, and we need to keep vigilant to continue to watch for further spread within the United States.
How do you control it once it's already here? How do you know when you have it under control?
Active surveillance is how you normally know if you have something under control, right? So if you have a control effort and then you're looking for it in places, that are likely, and then making sure that you can try to capture places where you may not have as good sort of eyes on it, that helps you understand the distribution and the movement, and helps you also understand when you are starting to gain traction with your control efforts. So usually what happens is we've got two forms of surveillance, right? We've got our passive surveillance, which is part of how we discovered this in the first place, is that you have trained veterinarians and other allied professionals and educated farmers and people in the public who understand that there's a higher risk, who know to alert the authorities if they see a problem. Active surveillance is when you actually go out and you're trying to catch populations, or you're using sentinel animals in order to see what might be out there. So they're primarily for animal diseases, where you put a species that might be susceptible in regions where you're very curious to see if you have a problem, and if they start showing the symptoms, then that tells you that the virus, or in this case, the fly, is out there.
So I know the broader question here is that we should all be concerned about these things for some reasons that I think we're about to get into. But, for the screwworm in particular, who should be the most concerned? Is it people that own livestock? Is it people that have pets in the area? What should people be looking for?
Yes, this is one that's a little bit different than some of the others. This is absolutely regional, and it should be across the board. So yes, livestock may be more impacted given the strong impacts that the worm can have. It can do a lot of damage in a very short amount of time. And so it can kind of get away from people. You can't just leave your livestock for weeks and weeks and then come back and expect everything's fine if this is happening. For dogs and cats, yes, owners in areas where New World Screwworm has been reported, or has been reported in adjacent areas, should be on the lookout and should not, give it the weekend to see. This is one where really getting to the vet, getting it diagnosed, getting it taken care of is really important. And there are, FDA basically hurried up some drug approvals in order to have the treatment available for pet animals should there be an issue with a pet who has an infestation. And obviously people, if they have it, they should, again, go directly to healthcare providers and have that assessed in order to make sure that they don't see progression.
So there is a treatment available.
Yes, there are a number of different kinds. There's a drug that can be used to basically kill the larvae, and there may be additional treatments that are needed depending on the severity of the infestation. So again, I'll just give the little content disclosure, squeamish, step away for a moment. When you have these, they're causing wounds, and the wounds may need wound care, whether it's debridement or other kinds of treatments. There may need to be some antibiotics involved if there's a secondary infection. So it really just depends on the location and other characteristics of that presentation.
And just to get a handle on the current outbreak that's happening, is it growing? Does it seem stable? Do we just need more information to know what's happening?
We are seeing continued reports and expansion of the geographic range. So I think this, is one of concern. And I would not say that right now I feel confident that it's under control. I think we're understanding that it is more than just one or two cases, right? This is absolutely something that has some spread that suggests that the flies have an established population. And so now it's just a matter of what are our control efforts going to do in terms of that regional area? And we're talking about 2 states. So that's a pretty big area. Texas isn't small. And this isn't just in a tiny cluster within Texas. This is, across a range. So yes, I would say this is something to keep an eye on.
And you mentioned that, I think you said sterilized males is the way that you control this population. Tell me more about that.
So we do this for a lot of vector-borne diseases. Well, when we have the technology and, are able to do so. But when you have a sterile male, when it mates with a female, there won't be larvae. And so when you sterilize males and release them, this is something you have to do fairly continuously, because what you're trying to do is basically dilute the reproductive rate of the fly by using males that are not going to lead to progeny.
So let's bring it all together here. And I think this is the big question of, people want to know, why should I care? Or why do I feel so, I think the better question is, why do I feel so alarmed by these headlines? Because they are alarming, but maybe not for your own personal safety if you don't live in an area with screwworm. But what's the bigger picture here?
I think there are a couple reasons that these in particular kind of garner our attention. I think with the sloths, there's that tug at the heartstrings, right? That, even if I as a veterinarian know that smile the sloth has is not the same meaning as the smile a human has, we still have that emotional response. And that gives us the opportunity, right, to say that when we have a more charismatic animal affected, that's just the tip of what's actually occurring across many different species, some of whom we may not have as strong an emotional connection to. So that's, I think, one piece of it. And then for New World screwworm, there really is a gross factor, right? This is kind of out of horror flicks. And this is a pretty nasty disease. And so content disclosure before you go Googling search, right? Or looking for New World screwworm images, be prepared. If this is not something you want to see, don't do the search. Just take our word for it that it's kind of gross.
And is there an economic impact here as well?
That's the biggest impact that we think about when you have agricultural commodities, right? So when you have cattle, right? Beef cattle that are being raised, or dairy cows that are being raised, or goats or sheep, or any other animal that could be susceptible. Remember, it's a very broad range. Then, especially with young stock, you can lose a lot of your replacement animals or the animals that are going to go ultimately into the food supply. So for an individual producer, if this, hits a bunch of their young stock or some of their older, more established animals, that can be a big economic hit. And then if it becomes more widespread, you could start to see impacts on the food supply. But that's going to take, I think, a much bigger step. You might, if there are local markets that rely on sort of niche animal rearing, so certain kinds of production practices and smaller scale, those may feel impacts a little bit earlier than, buying beef generally, for example, in the United States.
Just to bring it back to our original point, that animal diseases do really matter for human health. At the very top of this episode, you mentioned that we are kind of coming out of a greater understanding collectively of spillover events. It sounds like in both of these cases, that's not necessarily what we're looking at, but there is a surveillance factor here. Do you feel like the surveillance is working? Where are we in terms of our systems recognizing these things early on?
Yes, so there's been some disinvestment at the federal level in, for example, funding for certain programs that are part of either surveillance response or workforce structures, right? So you need to have all these different pieces in place. So state level, you may still see preservation of those efforts. You may, and we are seeing actually some coordination at the federal level, especially for New World screwworm. That would not necessarily be the case for the Florida sloth story, which is really more of a state-based response. And where you saw that they did the necropsies, they did additional testing, they did start looking, which I think is a positive, right? That when you look for things to better understand what's going on, when you have, for example, clusters of deaths in animals imported from another country that may have been wild caught, that is a very appropriate response. Where I think that we need to do better writ large, and this comes back to other high consequence animal diseases, not just New World screwworm, but like H5N1, avian influenza, is really keep those active surveillance structures in place and invest in that front line of defense. And so those are your veterinarians, the allied professionals, and then any producers who are really going to be the ones maybe engaging in animal treatment before you would even get to the point where you would call a veterinarian. And in rural areas where we have a shortage of veterinarians, there aren't enough to go around. There's especially not enough to go around for smaller producers and for people who just may, keep some backyard animals or, that have to drive 2 hours to get to a veterinarian, right? We need some other structures in place, and we need to do some creative thinking on how we can build that workforce up or provide other strategies for filling that niche.
Well, Meghan Davis, thank you so much for joining us and for laying out yet more examples of why this is so important, animal diseases and human health. Thanks for joining us.
My pleasure. Great to be here.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.